So this is the second part of development and plasticity. We have just a little bit left of discussing development, and then we'll talk about the plasticity of the brain, what happens either after brain damage and the brain needs to reorganize, or what's happening during our lifetimes that we see brain change because of particular experiences that we are having. So I'm stealing a quote that is in your textbook from Lewis Wolpert, 1991, who says, "It is not birth, marriage, or death, but gastrulation, which is truly the most important time of your life." Gastrulation is this time of brain development that is happening early during the embryonic period. So when our prenatal baby is still an embryo. And I have added this picture at the bottom this semester. I think it's important to just realize that there are times when any kind of teratogen is going to potentially be harmful to the physical forming of something like the central nervous system, the ear, the eyes, the arms, the legs, the heart. That they have these critical periods where it's very dangerous to have teratogens in our bodies if we are pregnant. And teratogens are defined as any behavior, environment, bodily condition that could be harmful to the developing organism. And so this can include illnesses, infections, malnutrition, toxic chemicals, drugs, and even we can talk about stress as a potential bodily condition. Some amount of stress when you're pregnant is normal, but there are amounts of stress that can be harmful to the developing organism. And it's not that later on that the brain is not sensitive, but later, if we have teratogens later during fetal development, it can influence the functioning of these systems and these organs and so forth, and these structures, but it's during the embryonic period that it is the forming of those structures. And so you can see the central nervous system up there at about 3 to 6 weeks, or 2 to 6 weeks in there. It's a very sensitive, very vulnerable developing brain. And while I mentioned several different kinds of teratogens, and you can go look up all of the different possible difficulties of being exposed to something like cocaine or lead or stress or malnutrition, lack of folic acid, all of that on this developing brain. But your author stays with the fetal alcohol syndrome and goes into that in a little bit more depth, where with fetal alcohol syndrome, we see a person who grows up with some hyperactivity, some impulsivity, difficulty maintaining attention. They often look pretty ADHD and get diagnosed with ADHD, even though it's really this different etiology than a lot of people come to ADHD with. There potentially, it varies a lot how severe this fetal alcohol syndrome is, but varying degrees of mental retardation are possible. Motor problems, they have heart defects, are more likely to have heart defects as they get later in life, and they also have these facial abnormalities, which I usually go through a little bit of my how really hard this is. It's already the mental part and dealing with the sort of struggles and challenges of trying to sit through school and the social, trying to be successful in the social world, but they have these facial abnormalities that really can cause, especially now that we know more and more about it, can cause a great deal of prejudice against them. And I sat next to a woman for 8 years working side by side, and she would comment often about another one of our coworkers' granddaughters having facial abnormalities of those kind of elfin features, and the way her face was, that she says it looks like she has fetal alcohol syndrome. And all I could think is, I don't I just don't like prejudice of any kind, and that child has enough of a struggle without that kind of prejudice facing her. So it really is something to be careful about for so many reasons. But this is happening. This fetal alcoholic syndrome can be so severe because alcohol is suppressing glutamate. If you remember, that's a widely distributed excitatory neurotransmitter. We're going to see it when we're talking about learning and memory for strengthening synapses. So I'm suppressing that, and it's enhancing GABA activity. So gamma aminobutyric acid is a widely distributed inhibitory neurotransmitter. And what this means is those neurons are not going to be receiving they're not going to be as strong as synapses because they're being somewhat inhibited from the GABA, but also they're not receiving the glutamate, that they are not going to receive the neurotrophins that they normally would, and we see a lot more apoptosis, so just neural death in the developing brain. Okay, so different neurons in different areas of the brain, they have different functions, and so they vary from each other. They're different from each other in their shape and their chemical components. And so von Melchner and colleagues asked this question of what happens when we transplant neurons. And this isn't they took neurons and transplanted them into another area of the brain, but they transplanted the potential function they might have, if that makes sense. So they took the ferret, which is an animal whose optic nerve still needs to develop and find the thalamus after it is born. And they damaged the superior colliculus, they damaged the visual cortex on that left side. So those are the places where that thalamic input is going to go to, and where the optic nerve is going to go to. And then they also damaged the auditory input. And the question was whether or not the thalamus would rewire so that visual input basically would be sent to the auditory cortex. I'm trying to make this as simple and clear as I can, and it's difficult. So what they did was they presented a tone and trained the ferret to turn left. Okay, so this is my auditory input. I'm learning to turn left. And they also presented the ferret with a red light that told the ferret to turn right, but they made sure that the red light was going to the right hemisphere, so the normally wired hemisphere where the ferret is experiencing vision just fine. So the light is telling it to turn right. Well, now they go and they take that light and they present it to the left hemisphere. You can see them presenting it here to the right eye in that bottom sequence, meaning it's going to the left hemisphere. And the question is, does it turn left because it's going to this rewired hemisphere, and so it's going to the auditory areas? Or does it turn right because it's still interpreting that visual information as visual information, even though it's going to the auditory areas? And so they present it to the left hemisphere, and the ferret turns right. So it looks like those auditory areas of the cortex are now interpreting vision as visual information. So your author spends a little bit of time talking about fine-tuning, the fine-tuning of the brain and of dendrites and axons by the experiences that we are having. I've had a student in my psychology of music class ask me several times about this idea of the brain that changes itself, or how we can change our brain through experience. And it's fascinating what we can see, and it's also there are limits. But this research comes from Purves and Hadley in 1985, and they injected these mice with a dye so that they could watch the dendritic branching, okay, of different neurons and how that changes based on experience. And so this is just showing two different neurons at time 1 in comparison to time 2 over on the right, and you can just see that there are some of those branches are elongating, and so that's going to create more receptor sites and more ability to be communicated to from other neurons. And some of those branches are retracting, as we just see this neural change based on experience. And my memory is these were adult mice. Some of the classic research that has been done in this area was William Greenough, who found that rats who had enriched cages in comparison to rats who had so paltry cages without much in them, usually they took away any kind of running devices or puzzles and things they could do as they move through, what are those called, those mazes, and they also took away social engagement with other rats. Those ones that were in enriched cages that had all of that, the social engagement, the mazes and the running wheels and places to run and do things, they had thicker cortices, more dendritic branches, and improved learning. And of course, after finding that, many people have gone in and looked what exactly was it about those enriched cages? Was it the mazes? Was it the running wheels? Was it the ability to go to different places? Was it the social world? And it all looks to be pretty important. So I have Rosenzweig and Bennett as just one example. But what they found was very important was physical activity. Having a running wheel and having room to have physical activity was an important part of the developing of an improved, thicker cortex, like a more a brain that's going to be better at learning. And I have here just in general in humans we see similar results, and this is not just correlational, but experimentally randomly assigning people to certain different kinds of physical activity appears to we see a lot of I'm going to jump to the bottom one, that we see a lot of enhancement in cognitive processes and brain anatomy that we don't see with other kinds of, so people who think that it's important to do crossword puzzles or Sudoku and all of that, and it's not that any of that is hurting the brain by any means. And I'm sure as we're doing crossword puzzles, we're getting better at crossword puzzles, but what appears to help the most with just maintaining our cognitive processes and our memory and everything is physical activity. And I've seen one study in one of my textbooks that talked about how great it is as we age to learn new dances. So not you are doing something that is a learning activity at the same time that you are doing that that can be pretty strenuous physical activity depending on the kind of dances that you're learning, and that appears to be very helpful. And I wish I would see more research kind of on that, because I espouse this importance of physical activity a great deal, and especially, as I said, aerobic exercise, getting that blood flow to the brain and allowing for that neurogenesis in the hippocampus. He also states, as I was just talking about the crossword puzzles and not really seeing that what's called FAR transfer, that as we're training young people in Latin and Greek, we've gone through different times in our educational systems where that's what was very focused on, thinking that it would help them learn other things. Training young people in Shakespeare plays, advanced mathematics, what we see is that people learn Latin and Greek, and they are better at maybe languages or learning that kind of thing. At mathematics, we see that they get better at those kinds of problems. And I think it's a strong statement that it doesn't help at all with other things. As I don't know, as again in the psychology of music class, and we talk about how much music might help us to learn languages. And I have seen research looking at how much learning an instrument helps us to learn mathematics, but only one study. But we tend not to see that FAR transfer quite the way we want to see that FAR transfer. It really appears to be the physical activity that is helping, and especially, again, as we age. And I have this small bit also on the effects of specific or special experiences, like specific experiences that some people are going to have, that neurons become more finely tuned and responsive to experiences that have been important to us in the past. And so experiences that we're not having, we're not going to see an atrophy of the brain. We're going to see the brain really rewire based on experience. And so some of this we see in the brain adaptation of people who are blind since infancy, that the visual cortex, I mean, it still wants to be active. It's still going to have brain activity It's not going to atrophy. So now their visual cortex responds to Braille and to identifying other objects by touch. And so I have some people say, well, just because you're blind doesn't mean you're better at hearing or better at feeling things or have more sensitive sense of touch. And I say, well, it's not, yes, that's true at the level of the receptors, but what's happening in the brain, you have more cortical space devoted to, in this case, identifying objects by touch. And if they have used the transcranial magnetic stimulation to inactivate that visual cortex of blind people, and they have found that it interferes with their ability to identify Braille objects. So just another piece of evidence that they are identifying their Braille using the visual cortex, as now they're not getting any visual information to it. So to continue talking about fine-tuning based on a specific experience in people's lives, where different people have different experiences, we look at musicians for a little while here. And first we see that the MEG responses, so that magnetoencephalography, where we're looking at those faint magnetic fields, their responses to pure tones are twice as strong in musicians than in non-musicians. With musical training, we see an enhanced responding in subcortical structures to musical sounds and to speech sounds. I have a picture there of some of the areas that are larger in musicians than in professional musicians than in amateur musicians, and larger in amateur musicians than in non-musicians. And a lot of this is, it sounds like we might see some of this. This is correlational, that maybe I went into musical training because I had an ear for sound, but there have even been studies where they have assigned young children to take keyboard lessons for a year, and we see some changes in abilities. They haven't looked at the changes in the brain, but we see some changes in abilities that suggest that this is based on experience, that it's going in that direction. And in fact, so I'm teaching the psychology of music, and we just finished our music and the brain section, which was fascinating to me and very challenging because it showed how really complex this all is. But to kind of fit in with this, it looked like musicians had their auditory cortex was 130% larger than the auditory cortex of a non-musician, and that what they're being helped with, what we're seeing a larger response to, is to musical sounds. Speech sounds have some overlap with our intonation and prosody and changes that are kind of similar to some pitch changes, but that non-musical sounds, so animal calls and so forth, that's not, we're not seeing the change in response to those non-musical sounds. And finally, he goes into brain reorganization, how it can go too far with this focal hand dystonia. This he talks about on pages 129 and 130, and usually I put up these pictures on the overhead projector. A picture really does say 1,000 words here as what it shows, and the only thing I could get close to doing it with was to show this from the neuroanatomy section again, where if we stay over in A, in the somatosensory cortex, I think it's A. Is it A or B? He is talking about A because it's the feeling of the hand. That we have this homunculus, right? And part of that representation in the brain is the hand, and then we have the fingers and the thumb up there. And for people who have musical training, we see this area grow because they are they are feeling their hands so much when they are playing those musical instruments. And when we see brain reorganization go too far, brain reorganization is usually helping us, but in this case we can see a focal hand dystonia, where really what's happening is we'll see a particular part of the brain that is responding to more than one finger at once, as they are both reorganizing such that what's responding to the, let's say, the index finger and the middle finger are, both of those areas are growing, but if they grow in such a way that they overlap, it gets more difficult to tell them apart. And so we can see this kind of, sometimes they talk about having a rigidity in their hands, like a very uncomfortable feeling, and sometimes they have a hard time moving one finger without moving the other. So this can happen to musicians, and it sounds to me, if I remember, there are particular exercises they can do. I've been asked this a few times by students, particular exercises they can do, and I think there are ways to stimulate. So I think it's little electrical stimulations to those fingers, but don't quote me on that. I mean, we can't help it, but it just can happen when we are using our hands in such a way, and when our brain is reorganizing. Your author goes through 2 times in life where he discusses brain development, and then so really its effects on behavioral development. And we could do this throughout a lot of our infancy and toddlerhood as we're getting new motor skills and learning language and all of that. We are seeing brain development, but we could spend a whole semester talking about just that. Whereas picking these 2 times and choosing something to focus on is probably good. One is adolescence, and the other is late adulthood. So if we look at adolescents, they are starting to develop the ability to perform the anti-saccade task at this age, which this is, if there's a moving target, if there's something like a flashing light over to our left, there's a really strong impulse to look at that flashing light. Okay, and what the anti-saccade task requires is that you move your eyes away from that target. So you are inhibiting that impulse, inhibiting that wrong response, similar to what we talked about with the Stroop task, only I feel like it's very much more low level. And what's helping us with this is the development of the dorsolateral prefrontal cortex. We see that adolescents are not equally impulsive in all situations, that part of what influences them is their social context. And so if we look at prefrontal cortex activity as an explanation for their behavior, it doesn't explain it very well, because what happens during adolescence is it becomes more and more and more likely that they're going to have some risky behaviors. But what's happening with the prefrontal cortex is it is developing over that time, and so it should be becoming, over adolescence, somewhat less likely that they have these risky behaviors if it's just explained by prefrontal cortex activity alone. So another thing we have to take into account is this processing of rewards. And apparently for adolescents, that part of the brain, those more subcortical structures, the reward pathway, I usually go a little bit into the limbic system being developed and hormones as well, but just looking at the reward pathway, that is what's important to them is this anticipation of rewards, and particularly in specific social contexts. So when they are around their friends and trying to fit in, and that reward of fitting in really is very important to adolescents. The other time he talks about is old age, although some of this starts pretty young. So the volume of the hippocampus begins to decline. The frontal cortex begins to thin at age 30. So some of this is really beginning in our young adulthood. People who are older usually make their decisions more slowly. But all of this is important. These are important things that we see as people age, but they're really based on averages across many different people in many different walks of life, some of whom are kind of allowing themselves to atrophy in some ways, especially if we have the kind of job that is not intellectually stimulating and challenging to us, and also we aren't doing our aerobic activity and staying active, we are more likely to see greater amounts of this. Whereas people who are in these jobs that are creating some challenge, that they are constantly being stimulated and are also continuing their different kinds of strength exercises, aerobic exercises, we're going to see a lot less of this. So these are really based on averages. And we also see, so I like to stick up for older adults quite a bit, one, because I'm becoming one, but also because of, if I look at my previous generations and like my grandparents and now my mom, as they get older, they have, they have more chance to have like wisdom, because they have this greater knowledge base. They have more experience over more different kinds of experiences, and they have found ways to compensate for these various losses of brain anatomy or brain activity, so I make decisions more slowly, and instead of using, it sounds like to me, one part of the brain to make that decision, just as an example, I might use several brain regions as a way to compensate for that specific change in brain anatomy or brain activity. Okay, so it is Friday, and I'm going to do this little bit of summarization to put us where we are for Monday's meeting. That we've gone over neural development now in this development and plasticity section, talking about the processes that, proliferation, differentiation, migration, synaptogenesis, and myelination as those main processes. We talked about axon finding and how that happens and some of the research that told us about that. And then we went more into, this is all neural development, but that to me is the how that first growth and development happens. Then we talked about fine-tuning by experience and how different experiences mean different dendritic branches, different areas of the brain that are responding to the experience that we are having in our lives, that are those experiences being different between different people or different mice or different rats or whatever animal that we are talking about. And then we talked about development during adolescence and late adulthood as well, brain development. And so what's left of this is plasticity after brain damage. You can see some of this is talking about the plasticity. Any kind of fine-tuning by experience is the plasticity of the brain. So I'm going to go into this one more time of a book that I read by Norman Doidge called The Brain That Changes Itself. And he has taken, so he takes, they're really kind of vignettes or stories, but they are from different scientists who are doing research. So they're research-based stories, and they are awesome stories that tell us just how much the brain can change itself, and especially if we are doing the specific exercises that we need to do. So one of the people in the book is a woman who ended up opening a school for students with children with learning disabilities. Her family was very academic, and she could not sequence information at all. She couldn't even tell the time on a clock, on an analog clock, because of the brain damage that she was born with. And so she trained herself specifically on clocks, first starting with one hand, then two, then three, all the way up to 12. But this was hours and hours a day for days, for weeks, for months. I might have even gone into a year or two of doing this for hours a day to develop that part of her brain. And that's really, she's up in Canada somewhere with her school for people with learning disabilities or who learn differently. So we see this really powerful ability for change in the brain, but there are limits as well. There are limits to what we can do. But we're going to continue to talk about brain plasticity, and specifically after brain damage on Monday. I was hoping to get through this. I'm actually running a tiny bit long. But then we'll start talking about vision and move on to sensation and perception. Have a great weekend.